Good afternoon, everyone, and welcome to today's webinar. I would like to remind you that this conference is being recorded. At the moment, all participants are in a listen-only mode. For those that are connected by telephone requiring operator assistance during the call, please press *0. For those online that require assistance, please use the chat box on your screen. I would like to now hand the meeting over to your host, Jessica Hodge, Improvement Lead at the Canadian Foundation for Healthcare Improvement. Please go ahead.
Good day, everyone, and welcome to today's webinar. I'm Jessica Hodge, and I am your host for today's webinar, which is the 7th webinar in CFHI's discussion series, Community Dementia Care and Support, Innovations, Supporting People Living with Dementia and Care Partners Closer to Home. We are pleased to offer French simultaneous interpretation on today's webinar. If you would like to see and hear the presentation in French today and you have not yet been transferred, you can by letting us know in the chat box on the bottom right of the screen. Once you have been transferred, you will need to shut down your computer speakers and dial the number on the screen. We also invite you to share your questions and comments at any point using our chat box in either English or French. We will reserve verbal discussion of comments and questions to the end of the webinar, but encourage all of you to respond to comments and answer questions in the chat box as you wish as we go along. Also a note that we will summarize the chat questions and comments after the webinar and translate this to both official languages for sharing in a post-webinar synopsis. The post-webinar email will also include links to the recording of today's webinar. Our participants for today include representatives from across Canada. We are joined by representatives from regional health authorities, universities, Alzheimer's societies, research centers, Dementia Advocacy Canada, ministries, CADIS, CFHI, CIHR, Health Canada, Public Health Agency of Canada, community support organizations, dementia care organizations, retirement and long-term care homes, the Centre for Aging and Brain Health Innovation, AgeWell, the Canadian Frailty Network, the Canadian Medical Association, the Royal College of Family Physicians, and government health departments across Canada. Before we go further, I want to begin this webinar by acknowledging that we are meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, we acknowledge that I am hosting this webinar from Perth, Ontario, which is the traditional territory of the Anishinaabe, Huron-Wendat, and Haudenosaunee St. Lawrence Iroquois peoples. This territory is covered by the Upper Canada Treaties. I encourage you all to share in the chat box the territory and land you are joining us from today. Our CFHI team involved in creating and producing this webinar series includes Neil Dreimer, Nicole Pollock, Emily Lalonde, and myself, Jessica Hodge. My colleagues, Sheena, Kelly, and Isabel, are behind the scenes producing the webinar. Our presenters today are Philippe Boyer, Michelle Stillman, John Hamill, and Cian Lockwood. I'll now turn it over to them in turn to introduce themselves to you today. Philippe, thanks for being here. Over to you to introduce yourself.
Hello, my name is Philippe Boyer. I'm from Quebec City and I'm full professor at Laval University and also a researcher at the Center for Research on Aging in Quebec City. Thank you for having me.
Thank you for being here, Philippe. Michelle, would you please introduce yourself next?
Hi, I'm Michelle Stillman, the Senior Director of Operations at the Schlegel UW Research Institute for Aging. I'm really happy to be here today, so thanks for having us.
And John, over to you to introduce yourself.
There we go. I'm John Hamill, and I'm from London, Ontario.
Great, thank you for being here, John. Cian, would you please introduce yourself next?
Hi, everyone. Cian Lockwood. I'm a project officer with the Schlegel UW Research Institute for Aging. Glad to be here.
Great. We also have our session moderators, Mimi Lowy-Young and Mary Beth Whiten, who will lend their expert perspective to the information presented and to the comments and questions you enter in the chat. Mary Beth, over to you to introduce yourself.
I'm a co-chair of Dementia Advocacy Canada, which is a grassroots group of Canadians living with dementia and care partners. I'm also a member of the Ministerial Advisory Board on Dementia. I was diagnosed with probable frontotemporal dementia in 2012, and since then have been very active advocating for the rights of people living with dementia and care partners. And always happy to be a moderator.
Thank you. And Mimi, over to you for a brief introduction.
Hi, I'm Mimi Lowy-Young, and as Mary Beth, very pleased to be involved in these sessions. I am the chair of the AgeWell, which is a network center of excellence of researchers across the country developing innovative technology solutions for people, older adults, as well as people with dementia. I'm the former CEO of the Alzheimer's Society of Canada, as well as I am a senior fellow at the Institute for Health Policy Management and Evaluation at the University of Toronto. Thank you.
Great, thank you. Thank you to all of our presenters and moderators for being here today. So our objectives for today's webinar are to provide an overview of CFHI's Community Dementia Care and Support webinar discussion series, broaden awareness and discuss 2 innovations that can improve early diagnosis and or post-diagnostic care and supports in the community, so Alzheimer villages and residences, and the Bias for Us guides, and facilitate a discussion around the potential spread of innovations to improve care and supports in the community for people living with dementia and care partners. So CFHI is a not-for-profit organization with a mission to collaborate with partners to identify and spread proven innovations to improve healthcare closer to home and community in areas of shared provincial, territorial, and federal priority. The impact of our work is lasting improvement in patient, family, and caregiver experience and health, work life of providers, and value for money. We believe in the collective power for change, so partnering with others where we can add value is central to our work and vision. Our Community Dementia Discussion Series will broaden awareness and discuss innovations that aim to improve timely diagnosis of dementia in primary care and post-diagnostic supports, including coordination and navigation. To find out more about the topics and webinar dates, you can visit our webpage on the CFHI website. If you know about an innovation that could be spread across Canada that improves timely compassionate dementia diagnosis in primary care or coordination and navigation of post-diagnostic care and support that would work in the COVID-19 context, please email us at the email provided on the screen to let us know. For your consideration today and throughout the series, what promising innovations exist that could be spread across Canada, including in the COVID-19 context? What is the feasibility of your organization and or community to implement and spread the innovations? Where can CFHI add value to support a multi-jurisdictional approach to spreading these innovations? And what are the partnership opportunities to help spread innovations to improve community dementia care and support? I'll now hand it over to Mimi and Mary Beth, who are going to answer some questions for us. And so, Mary Beth, what is needed to improve access to information and services post-diagnosis for persons living with dementia and care partners?
Thanks for that question. You know, I don't think I need to go over the many challenges that Canada has in accessing good quality care in a timely basis. In fact, that was one of the reasons why the National Dementia Strategy Plan was created. So what's happening? Why are we falling down? I think the model that we currently use, which it needs to be changed. I think we need to have a model that better enables integration services post-diagnostic. The country of Scotland uses a model that I like, which is after diagnosis, the person receives a full 1 year of support and care, and that's for both the care partner and the person living with dementia. And so then there wouldn't be that drop of understanding of, gee, I have a diagnosis, now what? There's a few things. I think we also need to be vigilant at creating data sets that as we are going through and diagnosing people and providing post-diagnostic support, we need data sets to be created and used so that we then can look and say, all right, how are we actually doing? How can we measure the results of post-diagnostic support? So the data sets is a very important one. I think we also need an 800 number. If you know me, that's not a new thing that I say. I know there's discussion about it, but until it actually happens, then we will continue to receive fragmented support after the fact, because it's not necessarily very clear for all people where to go and how to access that support. The other thing, and I'll try and tie it up, but the other thing that's important too is that if we're not having a measurement of this post-diagnostic support, if there's, if we're not putting an A, B, and a C on it, then how do we know that we are successful? And so this is where I think we can tie in financial support of organizations to actual, a marked report saying, yes, we're doing this, and therefore the government would then give them money accordingly. And then finally, we have to do this, of course, now through the COVID. And so all the things that we were struggling with before, it's even that much more intensified. So I think, can we do this? Yes. But we need some great minds to be coming together and putting this forward. Thanks, Jess.
Great. Thank you, Mary Beth, for those reflections. Mimi, I'd now like to ask you, when could a virtual solution help support people living with dementia in Alzheimer villages or residences?
I would suggest that during this COVID period, technology and virtual environment has been highlighted as a solution to many issues in terms of loneliness, support for people in their own environments, and that there are technological solutions that can be embedded in both the residents and across community to support older adults experiencing any stage of dementia and to support their caregivers. I think what's really interesting is that there already exist technologies that can support people living in their own homes and in environments. For example, the idea of putting sensors in homes that can then help navigate individuals living with dementia in their own environments, like turning on the light when they get up at nighttime to go to the washroom so that there's a safe environment. We know that there are virtual assisted technologies such as the various voice technologies that can also cue individuals living in their homes to remember to do certain things during the day. There are also assistive devices or socially assisted robots that again can support people living in residences and in villages, in Alzheimer's villages. We also have technology now that in the late stage of dementia can use facial recognition to detect pain in people with advanced dementia. But I must remind everyone that technology can never replace human touch, but can really serve as assistance to individuals to live and to interact with people, as well as to live safely in an environment. We're now seeing residences being developed that are technology enabled, have enabling technology built into residences, and AgeWell has its newest network and hub in northern BC has been working with dementia residents in looking at the built environment to support people again to live safely and to live a quality of life that they can benefit from these technologies to support them. So that's how the virtual environment And just one last point. We have found through our own research through AgeWell that people over the age of 50 and over the age of 65 are much more comfortable with technology, not only as a result of COVID, but just the uptake of the use of technology by individuals, by older adults, and by caregivers. Thank you.
Thank you, Mamie, for those reflections. At this time, I'd like to turn it over to Philip to give his presentation. So over to Philip.
All right, thank you. So I'll be presenting about the supporting seniors with cognitive issues and their loved ones and talking about some promising approaches. The objectives of my presentation is first to identify strategies that facilitate home living for seniors with cognitive issues without burdening family caregivers, and also to describe characteristics of residential settings that have been found to have positive results for residents based on scientific research. First thing we're going to talk about is how to help family members and their loved ones with Alzheimer's disease or related problems with cognitive impairment to stay at home for a longer period of time that we are seeing now. And first thing we have to look at is what can we do to help better family caregivers to support their loved ones with cognitive impairment. And according to this scoping review, in fact, what they want is more flexible and customized services, a wider range of services as well, because their needs are evolving all the time and they are variable also from one month to the other. And also the type of services can change from financial advice to having support for bathing. So they're really asking for a more diverse type of services, but also to have a response when they are in need to have these services to be more quickly available. So these are the needs. They also mentioned that in many countries, the same, you have these community services that are very close to the person and the family member. But they also have their nurses and their physicians with whom they are talking about medical issues. But there's often a disconnect between these two, and they wish to have a better integration between professional and community services. Finally, many private organizations are also providing very suitable, interesting, and relevant services, but you have to pay. There's a cost for it, and sometimes there is a barrier to access these services. So they wish to have a better financial support so they can also from time to time to buy some services that they require, they need. And one thing that I think is not used to its full potential, at least in Quebec, for what I know, is the daycare center. Because I'm not sure that these administrators are that aware of the benefits that comes with daycare centers. You have this study that has shown that seniors with cognitive issues, in fact, when they attend a daycare center, they will benefit from that. They improve their quality of life, slow cognitive loss, preserve independence, and it also reduces the frequency of agitation and the use of psychotropic medication. So these are clear benefits for the person. And for frail seniors, there's also a reduced rate of hospitalization and admission to long-term care homes. So this is very significant, and mortality rate as well. And for the family caregivers, daycare centers, they reduce burden also and improve their psychological wellness. And when I mentioned that I think it's not used to its full potential, is because many daycare centers here in the province, they limit the number of days that a person can come to the daycare center to once a week and sometimes once per week because of the high demands. And when I visited one center in Switzerland, what they did, they see themselves as a travel agency. What I mean by that, it's the way they describe their service. They say, well, we're going to have a family member that would call us, and we ask them, what do you need? And if they say, I'd like my relative to come two days a week to the daycare center, and maybe Saturday night to the evening center, and maybe 2 days a month to have access to the overnight care center. And also sometimes I'd like to have services at home. And what they will do is they would tailor really services to the needs of the person with cognitive issues, but also to the family caregiver. And it's very popular, and it's a way to help these people stay at home in their environment as long as possible, but not suffering from it, but having good services. And here, when I mention that to administrators of a healthcare system, often they say, well, it's mostly the need is for the daycare center. But one interesting thing I found out in the province, in Chicoutimi, city, that a non-profit organization that is managed by seniors, they say, well, this is the need that many people, family caregivers, are mentioning, that they need not only daycare center, but also evening center. And so they open it, and nowadays it's a 7 days a week from morning to late in the evening service, and it's at its full capacity every year, all year long. So these are services that I think needs to be created so that the burden is reduced on the family caregivers, but at the same time, the person can stay at home longer because of the healthier situation for the caregivers. So what we have to do is to improve and diversify available support, step up the 24/7 home support, available respite beds as well. There's always a lack of it, and it's difficult to have access to it in emergency situation, and also to diversify other services that I have mentioned. Okay, the other aspect is that for many people, what will happen is they reach a point that because of different challenges that they are facing, they will move the person with Alzheimer's disease, they will move to a residential setting. So what are the characteristics of these international models that are innovative and are influential, and then that can help us to do a better job when it's time to offer housing options for people with Alzheimer's disease and their relatives. So I not only just read these studies, I visited many of them because this is my passion for many years. In fact, when I go to conventions and meetings, scientific meetings, I'm always taking the advantage of visiting different innovative Alzheimer housing projects. And in fact, many countries, they have these innovative models, but they are never the main type of model. It's always unique and innovative and special, but it's not like what is offered to all people with Alzheimer's disease. And in the United States, there's a model that is well studied and is well supported by science. It's the greenhouse model. And this model is very interesting because it's so simple. It's just that they just offer a house that is more suitable for people with cognitive impairment, but also with functional impairment. And what they will promote in these houses is really to have access to nature, having a decoration and an environment that is really residential, so you really feel at home. And they will promote on a daily basis social interaction between residents, but also with families. The question you can ask is, well, is that all window dressing, or are there real benefits for residents? In fact, we have now many more studies that have shown the benefits of these small type of residential care, and it has an impact on the reduction of functional decline, for instance, to improve quality of life. Also, family caregivers, they prefer this type of long-term care facility. Even the nursing staff, I'm not showing the slide now, but even the nursing staff, they prefer to work in this type of environment. So in Quebec City and a nearby city in Montreal, I've supported owners of private companies to create more suitable, tailored, housing option for people with Alzheimer's disease. And now the government is taking a step in that direction as well. I'm supporting the government as well. They call it the, I would say, elders' house. I don't know, Maison des Aînés. And so in Quebec City, the challenge was to create, with a big building like this, how can we have this housing more residential touch? And it was possible because what we did on each floor, we created like two households, two separated households, and the impact, because now it's open since almost 2 years, the impact is very significant on the resident and the level of interaction. We can see that what I've read in the literature is reproduced in a daily basis in these households in nursing homes. So even though they are in a big building, they really feel like they are in a home. As you can see, there's an actual kitchen, and we have like 30% of the residents that are there. They are the profile of residents that we would find in our nursing homes. But the impact on the environment and their daily activities is different because they are stimulated by others. It's not like a long corridor. They are already in a household. So they can have access to the kitchen. They can do whatever they want on a daily basis because we promote flexibility. So like the fridge, most nursing homes, the fridge in the kitchen on the floor is always locked with a lock. But here at Humanity, it's not locked. They can have access to it. Another project nearby Montreal is this building. So I work with these owners, and what we work, and this one is publicly funded, but it's privately owned. So people can go there and they just know our price. We created the concept of Frontstage and backstage. So what we did is really to create households, but we separated in the middle of it, like with very doors that are shut. What we call these, where they are the nursing staff meetings, everything that is operational, that doesn't provide quality of life for people with cognitive impairment. Well, there's no activities that is not worth for the resident that would be in the middle of their household. Everything happens backstage, and when we enter the household, we are in their home, and we make sure to keep the environment quiet and make sure that if we're there, it's to bring value to the residents. Other aspect that we mention a lot in the literature is to have access to the outdoors. And in Quebec City, it's like we are the plant of snow. There's a lot of snow. It's a harsh winter. So we had to find a way to give them access to the outside, to have access to the sun, but being manageable. And usually we always just offer balcony. But what we did is we put the balcony at different places in the building so they don't feel like it's one balcony above another. It's really that they feel the fresh air. And we also provided 2 big terraces as well, especially there's one unit for behavioral problems, so they can have their own backyard, if I can say, but it's a terrace. And this is something that you have to think right from the start because it has an architectural impact. So in conclusion, I think for many years we have promoted, as it has been mentioned earlier, the most important thing is really to have competent and people with good heart that take care of and support people with cognitive issues and their family members. But we cannot forget now all the literature and avoid what we know about the environment. We can do much better to create housing that are more tailored and appropriate for people with cognitive issues. So thank you very much for your attention.
Thank you, Philip, for your presentation. We'd now like to ask you to answer a few questions about the presentation. So we'll pull up those polls for you and I'll read them out. Prior to this webinar, were you aware of Alzheimer villages and residences? Yes or no? And I know more about Alzheimer villages than I did before participating in this webinar. Strongly agree, agree, neutral, disagree, or strongly disagree. I also invite you to type any questions you have into the chat box, and we will address them in the Q&A portion of our webinar after our next presentation. We'll now end those polls and move to our next presentation. So I'd now like to hand it over to Michelle, John, and Cian for the presentation on Bias for Us guides. Michelle, over to you.
Hello, everyone. Thank you so much for having us here today. As Jessica mentioned, we'd like to share some information on the Bias for Us guides, or BUFU guides, which are created by people living with dementia for people living with dementia. Provide strategies to enhance their well-being and manage daily challenges. Just to open up, we are from the Schlegel UW Research Institute for Aging, the RIA, which is a charitable nonprofit organization with the mission to enhance care and quality of life for older adults through partnerships in research, education, and practice. One of our signature programs is the MERA Alzheimer's Research and Education Program, or MERA. It is a collaborative research and education program that aims to enhance the well-being for individuals impacted by dementia. This includes people living with dementia, care partners, healthcare providers, and community members. MERA was founded in 1993 by Kenneth Murray, and the program originated at the University of Waterloo and moved to the Schlegel UW Research Institute for Aging in 2018. Now I'd like to pass it over to John, who's going to speak a little bit more in depth about the Bias for Us guide. Over to you, John.
Can everybody hear me?
Yes.
Okay, just wanted to make sure. Okay, this is Brenda's story about her starting the Bias for Us guides. So when Brenda Hoonham was diagnosed with Alzheimer's disease at the age of 53, she realized that very little information was available for people living with dementia. The dominant view at the time was that people living with dementia could no longer learn and be involved in their own care. Brenda knew differently and was inspired to address this gap to develop a series of resources specifically designed by and for people living with dementia. In 2004, connected with the various people living with dementia from all around Ontario and MERA to work on what came to be called the Bias for Us guides. The Bias for Us guides are designed to provide people living with dementia and care partners the necessary tools to enhance their well-being and manage daily challenges. What makes these guides unique is that they are created by and for people living with dementia and care partners. There are 14 guides and 3 unique series. The first series is written by people with dementia. It includes such topics as tips and strategies for managing daily challenges, memory exercises, and enhancing communication and wellness. The second series is written by both people living with dementia and care partners. It includes topics such as safety, food and meal times, social connections, and coping with loss and grief. The third series is written by care partners. It includes topics such as before diagnosis, young care partners, roles, and health and well-being. And back to you.
You were part of the development of the guides. Would you mind to share something about your experience while working on the guides?
Okay. Yeah, I was kind of nice working on the guides. The reason why I say that is when I was first diagnosed in 2017, I actually went to the Alzheimer's Society and basically said, well, I'm retired now. What do I do now? I've got this diagnosis of dementia. So what happened was at the Alzheimer's Society, they give me a couple of options where I can help out, both here at the Alzheimer's Society of London Middlesex here in London, Ontario. And also I was connected with MERA and given the contact information. So I did contact MERA and kind of was put in touch with helping out with the Bias for Us guides. So I did help with the Young Onset book, which was the last booklet. I'm also currently helping on the new booklet and the rewriting of and changes to the current booklets as well. So I kind of look at it, it gives me something to do because it's nice to be useful and active. And also it's kind of my way of giving back and being helpful. I've volunteered basically all my life, adult life basically. So why stop just because I got a diagnosis of dementia? So like I said, it's kind of my way of giving back.
That's great. Thank you, John, for sharing that. So as John has described, all of the guides have been co-designed with people living with dementia and their care partners using what we call as an authentic partnership approach. This approach actively incorporates and values diverse perspectives. It includes people living with dementia, care partners, and all stakeholders directly in the research process and decision-making, such as creating surveys, conducting interviews, analyzing data, and creating the content. So just a little bit about the impact of the guides. The guides have been very well received, making a difference for over 17 years. Over 100,000 guides have been distributed globally. And in 2019, the guides received around 4,000 views on our website. So a person living with dementia told us that these guides are the best information possible for somebody living with dementia to read. So as John had alluded to, we are working in partnership with the Behavioural Experts Ontario currently to create a new guide for people living with dementia and their care partners. So the new guide is called Isolation and Enhancing Social Connection, so you can look out for that soon. And then we're also refreshing all of the guides with a new design to make sure that they are up to date and accessible as well.
So to learn more about the Bias Forest Guides, or if you'd like to download a copy or order any print copies, please feel free to visit our website. The website is there on the screen. It's the-ria.ca/MEREP, so the ra.ca/MERA. And just thank you so much for listening to us today and taking the time to learn more about these guides.
Great. Thank you, Michelle, John, and Cian for your presentation today. We would now like to ask you to answer a few questions about the Bias for Us guides. And so prior to this webinar, were you aware of the Bias for Us guides, yes or no? And I know more about Bias for Us guides than I did before participating in this webinar. Strongly agree, agree, neutral, disagree, or strongly disagree. At this time, I'd also invite you to type any questions you have into the chat box for any of our presenters, and we will address them in the Q&A portion of our webinar after our next presentation. Keep your comments and questions coming, and what we don't get to today, we will answer and summarize in a post-webinar synopsis that you will get within a couple of weeks to allow for translation. I will now turn it over to Mary Beth and Mimi to share some reflections on what we have heard today. Mimi, over to you to lead this reflection.
Thank you very much. Excellent presentations. Thank you to both groups for their presentation. I first want to comment on the building of facilities that make it far more home-like for individuals living with dementia. There are many examples internationally, as you've identified, and I think now's the opportunity to make an effort to embed some of the principles of living environments for people living with dementia. Now, as we look at building new facilities and also renovating existing facilities, there is opportunity, I think, to encourage government to participate in the expansion of long-term care to ensure that the environments are as home-like and as proven to actually impact the person's progress in the disease. So comment that we need to look at involving and encouraging government to create policy around what type of environment needs to be created for people living with dementia. In terms of the guide, I think these are excellent tools and encourage RA and really make an effort to spread and scale these guides because obviously they have a lot of benefit to individuals, both caregivers and those with living with dementia. Thank you. Over to you, Mary Beth.
Thanks, Mimi. I too am a big fan of smaller homes for people living with dementia, and I don't think that there's probably been any time being more aware of this than what's happening right now with COVID and people living with dementia in long-term care. And we know that statistically there's about 80% of people who are getting COVID and dying. And so obviously this, how we currently are doing things, which is I would call warehousing, it needs to be changed. And as Mimi alluded to, this is the time. It's the time for, I think, researchers, for advocates, for politicians to truly come together and stand, shoulder to shoulder and saying, we need something different. And we not only need it, but as Canadian citizens, we should get it. And so I think really it's a cry to politicians and to get the warehousing needs to stop. Smaller homes, as we saw from our presentations, there's lots of great examples out there, and now we need to start to embrace those. The bias forest guides, I have to be a bit transparent here. I am actually a part of the team right now who's creating the isolation guide. I'm a huge fan of this material. And, I have a lot of respect for Brenda Hoonam, who was really forward-thinking, back, I think, 2012, in creating these bias for us, which involved people living with dementia. So she was really way ahead of her time. And now, here's the opportunity when we're talking about how can we affect post-diagnosis. These are the particular guides that imagine if you receive a diagnosis or you're giving a diagnosis to someone and you can say, and here is lots of material created by people living with dementia. And you walk out of your doctor's office with something that's actually tangible and helpful. And, as a person who has gone through a very bad diagnosis, if I had received those guides, I think it would have really made it would have made a huge impact on me. So just some thoughts there. Over to you, Jessica.
Thank you, Mary Beth and Mimi, for your reflections. I've received a couple of questions through the chat box, so we'll go ahead and address those now. A question came in earlier on about how many residents are in the units that Philip mentioned at the Quebec residences. And so Philip was kind enough to answer in the chat box that there are about 12 to 15 residents. Also, a question came in, are the guides also developed with input from dementia researchers? And Michelle kindly also answered in the chat box that yes, the MERA scientific director, Dr. Carrie McHaney, is involved, and we receive RAB for each guide, but they are not directed by researchers. They are directed and created by people living with dementia. Another question we received is, are there sample pages to preview before making the purchase? Yes, all the guides can be freely downloaded on our website. There is just a small cost for the printed copies. And so if you go on the website, under the description, there's a free download. But if you wanted a hard copy, you could add it to your cart for the price that is there on the website. One question for Michelle. Are you thinking of getting the guides translated? Michelle, would you like to answer that question?
Yes, we would love to have them translated in multiple languages, and it's really, it's a funding piece. So if we can receive funding to do that, then we'd be happy to do that. Right now, we're just focused on ensuring that they're all accessible and updating the order guides, which all the refresh guides should be launched in the next couple weeks, actually. And then we'll be looking for additional funding to help translate the refresh guides if we can.
Thank you, Michelle, for answering that question. And we will ensure that the link to the guides is available in the post-webinar synopsis, so you'll have access to it as well. Philip, a question for you. In the home-like settings that you discussed, how do you balance safety with full access to kitchen, for example?
Yeah, this is a very good question. And in fact, this is something that is not mentioned when you read the literature, the scientific literature, because they are presenting results related to the impact of these type of housing on the cognitive and the mood and the behaviors. But since I've been involved in these projects in Quebec City and in Montreal for the past 3 years, I've noticed that it's not for everyone, because the managing risk and being open to accidents and things like that is very important to mention that right from the start. When, for instance, in Quebec City, Humanity, well, if you want to be there and have your loved one there, but you want to have their medication on time and to be that your resident, your family member is based at like before 9, and you are very rigid in the way you seek care, these are not for you. If you don't want to have any accident to happen, well, it's not the place as well. And so I did a survey with a random sample, and it's going to be published in April. And we saw in the results that 20% of the population, they would prefer safety over flexibility and taking risks. And we're not talking about big risk, but we presented them with different scenarios, like would you allow your spouse with Alzheimer's disease to be in the backyard of the residence and to freely walk around, even though there's a fence? But, you know, there would be like 20%, 25%, they will say, no, I want them to be supervised all the time. So nowadays, when people they visit Humanity, there's a meeting, and they explain to them that, you know, here we let the resident, like for instance, participate in the preparation of meals, but you know there can be an accident. They can cut themselves. You know, they eat in plates that can break, so they can hurt themselves. We allow dogs to be there, but they can bite. You know, we cannot be sure nothing will happen, but this is a risk that we want to take, the people living there, to have a life. Otherwise, when you want to eliminate all the risks, but some people, this is what they want. This is what I've learned. It's something that I learned in the past, year or so. It's really, there are people that really need safety first, so you have to be upfront with them right from the start, because at the beginning we were promoting the fact that they will be stimulated, they will be dancing and singing, but there are other things as well. We left some, for instance, residents to work with hammer to build something. So when they saw the hammer the first time, they would say, oh my God, what is it? They are irresponsible, you know? So it's very important to be right from the start, very honest. What is the philosophy there, the values? And yes, we are taking risks, and it's something that we are proud of, but this is the philosophy of this building, this organization. But it's not for everyone. I thought it was for everyone based on the scientific literature, but that's not the case. It's not for everyone.
Thank you, Philip. And we also received another question. So how many staff are in the facility for about 12 to 15 residents?
Well, it's a very good question. This is another thing that we are very innovative, because I'm quite involved with them, because this group, they really want to take innovative measures. And one thing that we have a problem is we always talk about ratio, number of staff per resident. But when we have residents in this institution that are at the mild stage of the disease, other at the moderate, and other at the severe stage, and they are mixed together, well, sometimes there's one household that is more demanding to provide care there than another one. So what we do is that we do a monthly assessment of the functional autonomy of the resident, the level of behavioral problems, the number of falls, and we always adjust the staff. So some household, you would have like a ratio of 1 staff per 3 residents. Another one, you would have 1 staff per 7 residents, depending of the challenges and the level of autonomy of the group of residents in this particular household.
Thank you, Philip, for that answer. Michelle, another question came through about the guides. Have any thoughts been given in providing more information around culturally specific care that is available in communities?
Yes, so we try to keep the guides particularly more general as we distribute them globally and nationally. So none of the guides are specific to any individual community per se. But I think it's an excellent point in terms of like culturally specific care and something we can definitely take to the group to consider for maybe a future guide. So thank you for the question. I think it was Jessica. Thank you, sir.
Great, thank you. Yeah, I see a couple of people still typing into the chat box, so we'll just give it a moment. Okay. So I'm not sure there's any more questions. So at this point, I would like to thank Philip, John, Michelle, and Sian for their presentations today. I would also like to thank Mary Beth and Mimi for their thoughtful reflections and comments. Thank you to our producers, operators, and simultaneous interpreters for their efforts in making this webinar happen. And finally, thank you to you all for joining us today. In just a few moments, I will read out a few CQI questions, and your answers to these questions help us plan our future webinars. And so the questions are, overall, I was satisfied with my webinar experience. Strongly agree, agree, neutral, disagree, strongly disagree. Overall, I was satisfied with how I was able to actively participate in the webinar. Strongly agree, agree, neutral, disagree, strongly disagree. And do you have any other comments or suggestions to improve the content shared in this webinar? Once again, thank you to everyone, and we look forward to seeing you at our next webinar in the series on March 9th, 2021. Have a great day.